Welcome to the first video edition of the Loup Ventures Neurotech podcast, and I guess we need a different word than podcast now. I'm here with Jim Cavuoto from Neurotech Reports. Jim is an absolute expert on the business side of neurotechnology. He's been doing this for a couple of decades, knows everyone, knows everything, and it is really exciting to have him here. And what I wanted to talk about with Jim is some of the things he's seen in the neurotech business world in 2018 and some of his thoughts of what might come in 2019. So Jim, thank you.
Well, thank you, Avery. I sure hope I can live up to that introduction.
I think so, knowing you.
But we definitely have seen a lot of change, a lot of developments over the 18 years. We've been publishing Neurotech Business Report, our monthly newsletter. Many of these things we discussed recently at the Neurotech Leaders Forum in San Francisco. And by the way, congratulations to Loup Ventures, which won a Gold Electrode Award.
Well, thank you. I appreciate it. And thank you. Thanks for thinking of us.
Yeah. We've definitely seen a lot of progress in areas like deep brain stimulation. One of the themes that emerged from the recent Neurotech Leaders Forum, and also something we've seen here at the Neuroscience 2018 meeting in San Diego, emphasis on adaptive or closed loop deep brain stimulation. At Neurotech Leaders Forum, Dr. Phil Starr from UC San Francisco and a couple of other neurosurgeons who were on the panel expressed what they saw as the next generation, the ability to customize, adapt, improve on the therapeutic regimen based on feedback.
You know, things in the medical device world take a long time, and given that this is a trend you're seeing in 2018 where you're hearing people talk about this, you're hearing about devices in labs that are attempting closed loop DBS. When do you think that these systems are going to really hit the market? Like, what's the lag time going to be?
Yeah, that's a great question. Of course, as we heard yesterday here in Cameron McIntyre's session on adaptive DBS, 3 clinicians, 2 from Europe, who are already performing work using some of these techniques. Medtronic has a system, a couple of different systems that allows for adaptive DBS. They're being used in clinical settings for the most part. So we definitely already have patients who've undergone the procedures, clinicians who are perfecting the procedures. The fact that DBS is already approved, that we have hundreds of thousands of patients who have successfully gone through the therapy, makes me optimistic that changes or improvements, for instance, adaptive DBS wouldn't be a large regulatory hurdle. And if anything, in terms of reimbursement, you're more efficient. We're using less energy, so in theory, the devices are going to last longer, should lower the cost. So hopefully a couple of years.
Do you think there's any relationship between adaptive DBS and expanding the set of indications that DBS proves effective for?
Yeah, that's a great question, and I think it's most likely true. As you develop tools, now granted the targets are going to change. In fact, in Dr. McIntyre's session yesterday, initially they were talking about Parkinson's disease, but then when you look at dystonia, in Parkinson's disease, for instance, you're looking for a feedback signal in the beta range. And that high beta frequency tends to indicate that something's wrong, and you use it as a biomarker. When you're looking at a different disorder like dystonia, it might not be the beta frequency. Maybe it's a theta frequency. So the markers are going to change depending on where you place the lead, depending on what the disorder is. But I think you can generalize the feedback techniques and the customization techniques and the optimization techniques.
For the devices that are being used for the adaptive DBS, where are the sensing electrodes? Are they also deep down in the basal ganglia with the stimulating electrode, or are they on the surface? What's the variability there?
Well, what we've been talking about here is DBS leads, multi-contacts placed in the basal ganglia.
So the recording electrodes are in the basal ganglia.
But many of these same techniques apply with cortical stimulation.
Okay.
For instance, the NeuroPace system the responsive, really probably one of the first, probably the first adaptive or closed loop brain stimulation system to be approved by the FDA. They're using cortical stimulation, and they're sensing from surface electrodes on the cortical surface. So I think the principles apply whether you're going deep with probes or whether you're recording or stimulating from the surface.
Got it. And aside from adaptive DBS, what other trends did you see emerging either at the Neurotech Leaders Forum or just in your conversations over the last year?
Seen a lot of interesting work going on in neuroprosthetics.
Okay.
Now, neuroprosthetics is not as large of a market as, say, the neuromodulation segment of our industry. So, for example, in our latest market research report, which we call the Market for Neurotechnology 2018 through 2022, we see an overall market of about $8.6 billion. Neuromodulation is the biggest segment. More than half of that is neuromodulation devices.
And is that primarily pain is the indication?
Pain is the biggest segment, but guess what? DBS for movement disorders and other disorders is catching up. And also within neuromodulation, you have treatment of bowel and bladder dysfunction, OAB for instance.
Are you including the newer bioelectronic medicine things such as inflammatory disease in your neuromodulation estimate?
That's another great question and a fuzzy area, a topic that came up. Where do we draw the line? Different people, different research organizations, different commercial players.
Even in my conversations with people, the word neurotechnology means very different things. The word neuroethics means different things.
Yeah, there's different definitions. So we've trended, we at Neurotech Reports, just for the purposes of keeping track of how we count systems, how we count sales. We've been working with a pretty tight definition of bioelectronic medicine, where we're talking about neuromodulation that affects the gut, for instance. Neuromodulation that's affecting or modulating an end organ outside of the nervous system itself. Now, that's a tight definition. There are other organizations, the Feinstein, for instance, GSK, for instance, and some of the vendors in this industry who take a little more expansive view, and it may well be at some point that
And frankly, it doesn't really matter all that much, because as far as the projections go, what they're really doing is they're really building an intuition for where it's worthwhile expending time and resources. And there's certainly wiggle room. I mean, the difference between $8 billion and $8.5 billion, because you've slightly expanded the scope of your bioelectronic medicine definition, is it's not going to be changing anyone's mind.
Exactly. And the key thing is to get an idea what the growth rates are, where the growth areas are, and to see...
let me ask you a tough question.
Go ahead.
What do you think are the most valuable things that people can do with your work, with your research? When people read it, what do you hope that they're getting out of it, and what do you hope to enable them to do?
Yeah, we hope that when people come to visit our website or when they read one of our publications or our market research report, that they're not just getting a broad overview of what's in the industry, but getting some intelligence that allows them, if they're a vendor, for instance, or if they're an entrepreneur who wants to be in this space, that allows them to maybe position their product, to be aware of where they stand vis-a-vis the competition as it exists today, the competition as it might exist 3 years from now, might help them in terms of learning about regulatory pathways that others before them have tried and failed, or tried and succeeded. Perhaps enlighten them about relationships that they might be able to form with other players, strategic players in the market, or even distribution channels that they might be able to seek. So hopefully our readers, our website visitors, will come away with a better understanding of market and commercial related factors.
You and I were chatting last night, and we kind of agreed on the fact that there's really legitimately a sense of acceleration right now in neurotechnology, and I have genuine excitement about it, and I know you do too, and I'd love to hear what's causing your excitement. I mean, you've been doing this for 18 years now, something like that. And you've seen a lot of things, you've seen a lot of technologies, you've met a lot of people, and for whatever reason right now, there's a particular excitement, and I want to know why that is.
Yeah, look, we've gone through, over the 18 years we've been publishing, we've gone through some up periods and some down periods, a lot of down periods that we've lived through, but definitely this is as high a moment as I've seen in the history of the neurotechnology industry. A number of reasons why I'm so excited. Definitely the amount of funding that's coming from, not just coming from the federal government in terms of the NIH, but several different agencies in the U.S. and abroad. We have the Brain Initiative going on. We have DARPA with several of their funding programs. So investment from the private sector, new firms like Loup Ventures coming forward, recognizing that there's good long-term commercial value in investing. So definitely the money that's flowing into research and into commercialization. Ironically, one of the other things we've seen just recently is awareness from the general public, awareness from the government, awareness from clinicians that drugs aren't necessarily the solution for everything. And we've seen, because of the opioid crisis, what happens when a society becomes too dependent.
A great example is the growth of virtual reality as a means of pain or anxiety treatment. There are some really cool companies doing that work, and it in a way it shares
excellent example
it shares
of an
a lot of the similar
alternative to pharmaceuticals.
And it's not alternative in this sort of like hocus pocus sense. It's an alternative in the sense that there are ways to induce physiological and psychological changes in a human that don't involve putting molecules into their body.
Yes. So to go back to your question, absolutely. Initiatives like the recent HEAL initiative from the NIH, looking for alternative therapies, whether it's VR, whether it's neuromodulation devices, whether it's a surface stimulation or an implanted pain stimulator. There are alternatives, and finding these alternatives is not only going to make the patients better, but it's going to help solve the societal problem that has been created by addiction to opioids, which was caused, frankly, by an industry and by clinical communities and patient communities that just wasn't sufficiently aware of the alternatives to pharmaceuticals. So I think, in a way, this has perhaps been one of the biggest boons to the neurotechnology industry that could have come along.
Well, that's exciting to hear, both as Loup Ventures and as Avery. So I want to ask you a question that we ask all of our podcasts, or now videocast guests, and I didn't warn you about this, and I should have. What's your favorite neuroscience book?
Oh, good Lord. I guess there's some great books out there, but there's a textbook of neuromodulation that Elliot Crames and Hunter Peckham co-edited. The newest version just came out last year. It's a 2-volume set.
Oh, wow.
We're not talking about light reading here, but there's just an excellent assortment of articles in this book for someone who wants to maybe is new to the field and wants to get up to speed. It's a great, you don't have to necessarily take a whole degree program. If you want to get up to speed on what's going on in neuromodulation, what are the various segments, who are the key players, there's a real breadth of good pieces in that book.
Well, there you have it. If you want some light Sunday reading, we've got a good textbook recommendation for you. Jim, thank you so much. I love talking with you about the neurotech market because there's just a lot to learn. And I hope that our viewers or our listeners took away as much from this as I did.
Thank you, Avery. Appreciate it.